Thinking of moving to Canada? If you're a pharmacist preparing for the evaluating examination, this video is for you.
If you are preparing for the PEBC Evaluating Examination, you probably already know that mastering pharmacology and therapeutics is essential. What often surprises candidates is just how critical the behavioral, social, and administrative pharmacy sciences are to your overall score and to your future career as a pharmacist in Canada. Just about ticking boxes on the test. This domain is where sciences meets the patient experience. It's about understanding the why behind behavior, the how behind communication, and the systems that support safe and effective care delivery. Diving into this foundational component of evaluating examination preparation, we will unpack what this subject really means, how much it contributes to your exam performance, and why it's a powerful area to focus on, especially if you are aiming to stand out. By the end of this session, you will not only understand what's covered under this topic, you'll see why this often overlooked area might just be your secret weapon for success. So let's jump in. Here's what we are going to do today. Super chill, no pressure. First, we'll talk about what this subject actually is, like what does it mean when we say behavioral and social sciences in pharmacy contexts. Then we will go into why this section matters in the evaluating examination, how much it contributes, and why it might be that sneaky score booster you have been overlooking. We will walk through what topics are covered, how the course is structured, and what you are expected to know coming out of it. I'll show you learning tools we use, why this course actually works, like not just theory, but real strategies that help you remembering and applying stuff. We have also got a sample question to walk through together, just to give you a feel for the type of thinking this section asks for. And finally, we will wrap up with your questions, so make sure to jot them down as we go. Alright, let's get into it. What are behavioral, social, and administrative pharmacy sciences? This part refers to the non-clinical, people-centered, and system-level area of pharmacy practice. This discipline helps pharmacists understand how people behave, how healthcare systems work, and how to manage pharmacy operations effectively. It forms a major component of PEBC evaluating examination. So let's go deeper into behavioral, social, and administrative sciences. Behavioral sciences. This part focuses on the physiological and cultural factors that influence patient behavior, health decision making, communication between pharmacists and patients. So the topics may include health behavior theories, motivational interviewing, cultural competence, and patient education and counseling. The social sciences helps pharmacists understand the broader healthcare environment, including social determinant of health, equity in care access, roles of different healthcare professionals, ethical and professional responsibilities in society, and the topics include Canadian healthcare system structure, public health principles, interprofessional collaboration, and legal and ethical frameworks. The administrative pharmacy sciences equips pharmacists with the skills to manage resources and lead services effectively. It focuses on the business, managerial, and safety aspects of pharmacy practice, and topics include pharmacy operation, quality improvement and risk management, medication safety, system, leadership and organizational behavior, and finally strategic planning, and health policy. Why it's matter for evaluating examination candidates. These sciences are essential for understanding how the safety and ethically deliver care in the Canadian context. Beyond just knowing medications, they also help you succeed in real life practice, especially when leading pharmacy teams, educating diverse patient populations, navigating Canada's regulatory and healthcare system. Now, let's see the contribution of evaluating examination. Contribution of this section is 20% of the exam, which made up of content from this section: behavioral, social, and administrative pharmacy sciences. 20%, that's one fifth of your exam. And that's not small chunk. It's same weight as some of the heavy hitter science sections. But what different here is that a lot of candidates underestimate it. They focus heavily on pharmacology and therapeutics and leave this area until the very end, or worse, skip it. And that's where you can gain an edge if you treat this like a scoring opportunity, which is absolutely is. You are going to look into the evaluating examination much more balanced and way more confident. So, yes, 20% totally worth mastering. Think of this as a part of pharmacy that zooms out from just the molecules and mechanisms and look at how healthcare really works in the real world. We are talking about things like communication with patients, culture competence, health behavior theories, patient safety, ethics, professionalism, health system, and even a bite of pharmacy law and management. It's a mix of physiology, psychology, and health delivery all rolled into a pharmacy context. And while it might seem broad, once we break it down, we will start to see pattern, and you will realize that a lot of this is common sense when it's explained the right way. So in the next slide, I will walk you through the exact categories we focus on in the course and how each one ties back to your exam success. First up on our topic list, health promotion and disease prevention. This is not a just buzzword in public health. It's actually one of the most practical areas where pharmacists make a real impact. Think of things like vaccine advocacy, smoking cessation programs, lifestyle counseling for diabetes or hypertension. This is all about helping people stay healthy, not just treating them when they are at risk. In the context of evaluating examination, you will get questions that test your understanding of prevention strategies, screening programs, patient education, and even population health initiatives. So, if we have ever thought that's more of a doctor or nurse role, think again. Pharmacists are key player in this space. An exam definitely reflects that. The good news, this area is usually very logical and scenario based. And once you understand the principles, it's pretty scoring. Next up, we have got pharmacy management principles. Now, don't worry, this is not a crash course in running corporations or managing a massive team, but it does focus on the core concepts that help a pharmacist running smoothly and effectively. We are talking about inventory control, workflow, human resource basics, budgeting, scheduling, and quality improvement. The kind of stuff that keeps a pharmacy from turning into chaos. In the exam, you might see scenario questions about staffing issues, resource allocation, or even how to improve patients' flow and services delivery. These topics test your ability to think like a future manager, even if you are not aiming for a leadership role just yet. Because let's be honest, whether you are in retail or hospital, you will end up using management skills in one way or another. Let's talk about something super important, especially if you are planning to practice in Canada, and that's the Canadian healthcare system. This section helps you understand how the system is structured, how it is featured, and most important, where pharmacists fit into the big picture. We will cover things like the rules of federal versus provincial governments, how services are delivered, how drug coverage works, and where pharmacists have authority to prescribe or adapt therapy. This is not just about memorizing facts, it's about being able to think like a healthcare provider within a Canadian context. So, whether you are in Canada or just want to feel more confident about how the system operates, this section is a game changer. And yet, it definitely shows up on the evaluating examination. Next up, one of the most fundamental pieces of being a healthcare professional is professionalism and ethics. This section dives into the values and behaviors that are expected of pharmacists in Canada, like integrity, accountability, respect, and putting the patient first. Sounds simple, right? Sounds simple, right? But the scenarios can get tricky. You will be expected to navigate things like conflicts of interest, confidentiality, informed consent, or what to do when you witness a colleague making mistake. So, yes, these questions are often more about judgment than memorization and how you apply professional standards in real life situation. The best part, once you understand the ethical framework and core principles, you will find these questions very manageable and actually pretty interesting too. And now we get to one of the most high stakes and honestly one of the most tested area, patient and medication safety. This is where your role as a pharmacist truly shines. It's all about making sure the right patient gets the right drug at the right dose at the right time. So right patient gets the right drug at right dose at right time without harm. We cover things like identifying and preventing medication errors, understanding high alert medication, reporting adverse drug events, and using tools like root cause analysis when something goes wrong. On the evaluating examination, you will likely face scenario based questions here, situations where you need to spot the risk, intervene appropriately, and most importantly, protect patient safety. So even if you are great at the clinical stuff, this section is what separates a good pharmacist from safe one. And that's something the exam absolutely cares about. Now let's wrap up the list of topics with something a bit more people focused, leadership and behavioral sciences. This part explores how pharmacists can lead, not just by title, but throughout influence, communication, and teamwork. It covers different leadership styles, motivation theories, resolution, and how to foster collaboration in healthcare settings. But it's not just about being the boss. It's also about understanding human behavior, what drives patients, what motivates your team, and how your leadership can impact both safety and outcome. The exam lab to test this through workplace dynamics, patient counseling situations, and decisions making under pressure. So, whether you see yourself managing a pharmacy someday or just want to be go-to person you on your team, this section helps build the mindset grounded in real behavioral sciences. And last but definitely not least, we have got research methods and literature evaluation. Now, before your brain goes, oh, states and study design. Don't worry, this part is actually super practical once you break it down. This section is all about understanding how research is conducted and, more importantly, how to critically evaluate the studies you read. You will learn how to spot good evidence, indefinitely bias, identify bias, and know when a study conclusions are actually valid. The exam might ask about study types, like the random study versus cohort studies, or test your ability to interpret p-values, confidence interval, or levels of evidence. And honestly, This is the foundation of evidence-based practice. If you want to confidently recommend therapies, defend your choices, or explain risks to patients, this is skill set that makes it up. All right, let's break down how this course is actually delivered, because structure makes all the differences between you are studying for the evaluating examination. First up, the whole thing is wrapped in 7 comprehensive lectures. Each one is targeted, focused, and mapped to the exam blueprint. Lectures are delivered live on Zoom, which means you get real-time interaction, discussions, and that sense of classroom energy, even online. All sessions are recorded, so if you miss one or want to revisit a tricky part, no problem. You have got flexible access. Next, there's a dedicated WhatsApp group. It's where you can ask questions, clarify doubts, and honestly, just not feel alone in this journey. And finally, we have got MCQs and interactive activities built into these sessions. So you are not just passively watching, you are applying what you learn as you go. So whether you are working full time or juggling life's chaos, this course is designed to keep you on track without burning you out. So, what can we expect to walk away with after completing the management course for evaluating examination? First, you will have a solid understanding of all the behavioral and administrative topics outlined in the PEBC syllabus. No more second guessing what's important. You will also learn how to actually apply that theory in real world Canadian pharmacy practice. Because knowing facts is not enough. You need to use them. Then there is the practice. You will tackle over 300 case based evaluating examination style MCQs designed to mimic the actual exam. So nothing feels unfamiliar on test day. And finally, you will gain the strategies and confidence you need thanks to live support, active discussions, and a structure that keeps you accountable. This course is not just about passing the evaluating examination, it's about building the skills to thrive in Canadian pharmacy. Now let's talk about what you actually get when you join the course, because we know the right tools make all the difference. First, you will receive a downloadable handout perfect for revising or highlighting key concepts. Then there are tons of MCQs designed to reflect the evaluating examination format, so you are always practicing with purpose. We also include realistic case scenarios that help you connect theory to practice, which is exactly what the exam tests. At the end of each topic, you'll get many quizzes, just enough to solidify what you have learned without being overwhelming. And yes, you can ask live questions during sessions. So, no confusion. Everything is built to keep you engaged, supported, and prepared to succeed. You are probably wondering what actually makes this course different from all others. First, it's built directly around the PBIC actual blueprint. So everything you study is high yield and exam relevant. No fluff, no guessing. Second, the explanations are simple, clear, and straight to the point, designed for busy professionals who don't have time to decode academic jargon. Third, we focus on practical, real life examples and case based teaching because the evaluating examination is not just about facts, it's about applying them. And finally, you will learn from an experienced instructor. So, if you want a course that's strategic, supportive, and seriously focused on the result, this is it. Let's walk through a real example of kind of questions you will face in the exam, and like questions that we covered in the course. A patient was given a wrong dose due to similar packaging. What should the pharmacy do? Now, take a look at the option. First option, number A, fire the assistant. It sounds like knee-jerk reaction, right? But not a systems-based approach. The second option, switch brands immediately. Again, it treats the symptom, not the cause. Third option, conduct root cause analysis and revise protocols. This is the correct answer. It reflects the professional, ethical, and structured response expected in real Canadian pharmacy practice. The fourth choice, delete records, definitely not. That's unethical and could have serious legal consequences. See how these questions go beyond memorization? They are testing your ability to think like a pharmacy professional, and this course gives you that mindset. All right, that's a wrap on the overview. Now it's your turn. What are you curious about? What's still unclear? Drop your questions and comments below or bring them to our next live session. Whether it's about the exam structure, the course content, or even just managing your study routine, we are here to help you. Remember, the only bad question is the one you don't ask. Ready to turn your exam anxiety into exam mastery? Start your journey toward evaluating examination success today. Just head over the link below to enroll and get instant access to lessons, MCQs, live sessions, and support from experts who know what it takes to pass. Thank you for watching.